This episode was pre-recorded as part of a live continuing education webinar. On-demand CEUs are still available for this presentation through All CEUs. Register at allceus.com/counselor toolbox. I'd like to welcome everybody to group therapy, which is a product of Treatment Improvement Protocol 41. Today we're going to be going over chapters 1 and 2. Tip 41 they actually did make into an in-service, which is what I loosely based the next sets of presentations on. And we're going to talk about some of the different ways you can use group and make it beneficial and helpful and hopefully easier than some other ways of approaching treatment. So in the first part of today's presentation, the goal is to provide an overview of group therapy, which is used in substance abuse and mental health treatment. And like I said, I'm loosely basing it on it, but a lot of times the groups that we're doing in substance abuse are the same ones we're doing in mental health. We're going to discuss the uses of group therapy in treatment, define 5 therapy models, explain the advantages of group therapy, and modify group therapy to treat and address substance abuse issues. So group therapy is awesome because it supports members in times of pain and trouble. It's something that we can make available. The community mental health center that I worked at before, and if you've worked in community mental health or even private mental health maybe, a lot of times there are waiting lists to get into IOP, to get into PHP, to get into residential, to get into detox. So one of the things that we started instituting was an intervention level psychoeducational group. So we were able to sort of keep a tab on people who were on our waiting list. They got on the waiting list and they started coming to these groups that provided them tools, provided them skills. We weren't treating any particular issue. We were really focusing more on